Hello and welcome to INGSA's Horizon series. My name is Christiane Allen and I am the Executive Secretary of INGSA, the International Network for Government Science Advice. Since 2015, under the auspices of the International Science Council and in partnership with the Wellcome Trust and the International Development Research Center, INGSA has become a leading global network to help develop and enable evidence-to-policy processes at all levels of government. In Horizons, our new series of global conversations, INGSA brings you leading-edge practitioners and scholars working at the interfaces of science, policy, and the wider society. Sharing their knowledge is one of our goals for this series, but we also want to involve the INGSA community. We are looking to pair up great minds for great conversations, whether they are emerging professionals or seasoned leaders. We've got a few interviews in store for you already, but if you want to get involved in the series, please get in touch with us. Recently, I had the chance to catch up with Professor Roger Pielke of the University of Colorado. Roger teaches and writes on a diverse range of topics, all relating to science, technology, and governance. Many of you will know Roger as the author of the foundational science advice book, The Honest Broker. I started our conversation by asking him for his reflections on how the world and science advice had changed in the context of COVID-19.
Thanks, Christiane. It's great to be here. Great to be Zooming with you all on the other side of the world. This is an amazing time. I mean, you and I both know that our field at the intersection of science and decision-making, some politics mixed in, has always been kind of a niche field in the background, a little bit wonky, as we say. And really with the pandemic, it has been put into the spotlight at the focus of attention, unlike at any time, I think really ever in history, certainly in my 25-year career. The fact that here in the United States, Dr. Anthony Fauci is not just a mini celebrity, he's a maxi celebrity. But it's similar in Sweden and South Korea, perhaps New Zealand, Australia, where science advice it's a thing now. If you go to the UK and you look at the newspapers, the tabloids, SAGE, the science advisory group for the British government, is in big headlines on the front page. So one of the most important factors, I think, is that science advice has its moment. And I think a second big factor is that it is truly global. We are all of us, literally, almost 8 billion people on this planet are going through this pandemic together in different ways, obviously with very different experiences, different outcomes, a lot of tragedies, a lot of really horrible situations for people, but this is a truly global event. And for us who study expertise in decision making, it provides us with a chance to test, to put to the test and to evaluate how well are we doing. Obviously, it's not just the pandemic where we need expert advice. It's all through society. But this gives us really the world's first comprehensive, not just a fire drill. This is the real thing to see how we're doing. And sometimes I think we're doing pretty well, and sometimes I think we got a lot of work left to do. So it's and we're I don't know what the exact phrase is. We're not at the beginning of the end, but maybe we're at the end of the beginning of this. So things are still evolving, and we're going to be with this for a while, and there will be lessons to learn and draw out for years, decades to come. But I do think it is a momentous moment in our field.
Yeah, let me just pick up on that, Roger, because it is a momentous moment in our field, and certainly it's interesting for the policy wonks like you and me and others to be looking at this. But it's something new and maybe even qualitatively different for the public to be scrutinizing science advice in the way that it has, and that's never happened before either, arguably. So, what does it mean when celebrity is one thing, but it's also quite contested? What does it mean when it's science advice is under such public scrutiny?
Yeah, I think it's clear that if we look at different areas of science at different times and at different places, contestation is it's just part of the normal course of events for science in politicized debates, whether it's climate change in the United States, or it was the MMR vaccine in Great Britain a decade ago, nuclear power in Japan or Germany. These issues have existed at I would say a much smaller, more parochial scale than they do right now. And vaccine hesitancy has always been a thing. It's always existed in it's greater in France than it is in Lebanon, for example. But the idea that science has been contested, I think, is itself not unique, but it's this shared experience. Like we're all around the world, we're all having the same sort of debates about lockdowns, about wearing masks, about who has the ear of decision makers. And I think it's that shared experience that it doesn't just unite us who are in the expert community, but it also unites the public around the world, because the same sorts of dynamics are going on everywhere. It's just that just like the impacts of the pandemic are large and significant, the consequences for science and science advice, and more generally for expertise in decision making, are just that much more profound because of the pandemic. So everything seems like it's more, it's more stark than are the normal topics that we have historically studied, which are, for the most part, not on the front pages of newspapers, don't cross borders sometimes, but not always, and are fairly parochial and technical. And now it's, as you say, it's public, contested, and we're in the middle of it.
Mm-hmm. It's definitely accelerated, and it's definitely much more front and center. But arguably, I mean, the types of questions that for which science advisors have been called in have always been precisely those, the politically contested questions. And partly that's the reason for the science advice is to sort of get us through the political contestation with the application of evidence. And yet, because they're so contested, the evidence itself is called into question. And I'm just wondering, because these are the very types of questions for which science advice is mobilized, are we seeing a new or a different role for science advisors, for science advice, when the questions themselves are really questions of public value, of political values, questions of social transformation more than they are technological, and yet we look for technological responses. So I'm wondering if we're starting to see forging a new role, or a more open role, or a more collaborative role for science advice in that context.
I think my sense is, the short answer to all of your ors there is yes. We're seeing all this right now play out. And, one of the things, as policy scholars, we're a little bit like doctors. Doctors spend a lot of time with sick people and less time with healthy people. And policy scholars spend more time with policies that are in deficit rather than policies that are succeeding. And one of the things that we're seeing in science advisory mechanisms is that despite all the wonderful progress that we've made as a global community, at the intersection of expertise in policy, expertise in politics, the pandemic is really revealing a lot of shortfalls. And I'll just give you a simple example, which I think it's not unique to the United Kingdom, but it's pretty stark. And it was just highlighted in a House of Commons report on science advice in the pandemic. The main science advisory body in the United Kingdom, SAGE, during the first months of the pandemic, and really up to the present, focused on epidemiology and specifically epidemiological modeling. So it had a disciplinary focus, and within the disciplinary focus, it had a methodological focus. And it turns out that one of the questions that Parliament and Boris Johnson apparently had in dealing with the pandemic is, how do we deal with both the public health consequences and the economic consequences? Because obviously the response to the pandemic has economic consequences if you're shutting down restaurants and travel and so on. And the response of SAGE to the inquiry was to say, well, we don't deal with economics. That's outside our remit. And for me, it's a stark reminder that for the most part, policymakers, whether they're elected officials or in government, they don't always just want facts. They don't want issues of uncertainty. They don't want just knowledge. They want options. They want to know, what could you do? And as debates in many countries, in the United States and in the UK and Israel and elsewhere, New Zealand also go back and forth between locking down, not locking down. The economy has been pitted against public health. And that has led to, in some places, very predictable political fault lines. But again, as a policy scholar, I know that there are more options than the two that are at the end, lock down or don't lock down. And so it raises for me the question, whose job is it to take public health and economics, just simply, those two? Obviously there's more involved, but whose job is it to take those two considerations, those two, as you say, valued societal outcomes, and put them together in the form of policy options that, you're not going to maximize one or the other, but there are trade-offs to be made. And it seems to me that the institutions that we've put in place, and by we, I mean, the global expert and political community, haven't quite got that integration down yet. We haven't figured out how to put together, and it's very easy to put a bunch of epidemiological modelers together and have them come up with, here's our curves, here's the uncertainty associated with it. But if it doesn't integrate, what do you do about restaurants? What do you do about travel? What do you do about borders? Then policymakers are then forced to do that on their own. And we shouldn't be surprised that elected officials facing a novel pathogen have no ability, no time, no ability, no expertise to do that sort of integration. So my thinking is, when it comes, we've done a really good job, I think, on the technical issues. I mean, the vaccine development is heroic. It's wonderful, the knowledge that we have of the spread of the virus. So I think actually there's a lot of technical successes. I think it is where we integrate knowledge into policy options, where we could be doing a better job pretty much everywhere.
You've raised so many important issues that are part of such a long game of science advice. I mean, what I think you're reflecting on there is, or what it raises with me, is really how we train both scientists and policymakers, how we build, boundary spanning institutions, yep. How we undertake transdisciplinary research that integrates so many different views. The main question you asked is, whose job is it? And it's really multiple jobs, but you're right that it's an integrated perspective. Can you think of, and this is probably putting you on the spot, but can you think of examples of types of institutions or organizations that are at least trying, if not starting to do this successfully? This sort of synthesis and options development that integrates the technical as well as, the economic and the values?
Yeah, it's a good question. And, as you well know, since we're collaborators, I'm leading a project that's focused on a 16-country international comparative assessment of science advisory mechanisms during the pandemic. We're right in the middle of the project, and initial drafts are coming in. I will say, I'm very impressed with the Dutch experience, which to some degree functioned as what you might call an honest brokering function, which is to lay out options that integrate across valued outcomes for policymakers to consider. The Dutch experience is also notable for the creation of what they call, and it's a common term, but a red team. But in that case, it was a formal red team to challenge the guidance, advice that was provided by the expert advisors. So I do think as we document and learn about experiences in different places around the world, we will see we'll see different approaches to the provision of advice. Whether or not that leads to better outcomes or not, is an open question. I'm also optimistic that the South Korean case, which by all indications, again, it's early still, but by all indications, science advisory mechanism worked really well. And it supported a response that also worked really well. So what I want to understand better is the degree to which these different cases are idiosyncratic. Are they contextual? Were the mechanisms put in place in a way that travels? Can we take the Dutch experience and move it to Israel, to Chile, to Ghana? Take the United States experience, which we could talk about a fair bit. Are there ways that we could ensure that that experience does not travel, and we avoid the pathologies that we see? So, I mean, I don't think that the story here is going to be all about shortfalls. There's going to be a lot of, there's a lot of quote unquote healthy people to study here also. But understanding, and this is the one, I think one of the real challenge of science advice is that one size doesn't fit all. There's not one mechanism that works everywhere all the time. And so being nimble, being contextual, and realizing, and it's not just geography or culture that we need to consider, it's the issue also. The fact that Asia has dealt with more than many places around the world, SARS and MERS over the last decade, maybe that set the stage for a better response, more receptiveness to science advice currently with coronavirus. In the United States case, which I'm documenting, there was a considerable amount of attention paid to pandemics more than a decade ago, which the H1N1 bird flu virus, that was, I guess, more of an epidemic than a pandemic. It's remarkable if you look at the data, the focus of attention of the scientific community, you look at the hearings held in the US Congress, you look at expert committee reports, pandemic preparedness disappeared from the United States as a focus of attention. So understanding these dynamics and for the work that we do, which spans borders around the world, because everybody needs experts everywhere in the world, and understanding how do we get lessons to travel, I think it will be one of the most important things from the pandemic. And it's only allowed because we can do these sort of comparative analyses of everyone going through the same sort of event at the same time.
Mm-hmm. Yeah, it's an interesting point you're suggesting about the specificity of the issue that needs to be taken into account here, because part of that is obviously the timing problem. So the difference between sort of a slow burning issue and a very urgent issue, and the fact that you need preparedness for the urgent stuff in order to be able to respond. But one of the ways in which issues become specific also is how they're framed at the outset. And I think that, again, just coming back to the project that we're collaborating on, one of the things that we've observed through some of the INGSA work has been that the framing of the pandemic in the early days was very different from country to country. And you point out rightly, I think, that the Asian countries had a certain framing based on their history. They knew sort of what they were looking at, what they were seeing. The US immediately seemed to jump to this economic framing of how do we safeguard our economy in this context? And that's what became predominant. Where I am in New Zealand, the framing right at the outset was one of, for lack of a better expression, we're all in this together. There's a collective sort of action that's required here. And in the absence of a technological solution, those collective actions were really the only, immediate solution in the early days of the pandemic. So I'm just wondering about the role of scientific advice in that early framing of issues. So we can typologize issues, like you say, and look at them in different contexts, but there is a specificity in how they're framed. And sometimes I think we struggle with the role of the technician or the expert in that. Can you comment on that, Roger?
Yeah, I mean, it's I think it's a fantastic point, and it's a great one. And in the United States, and I know elsewhere, the initial framing from the expert community was focused on flattening the curve. And people might remember there were graphics that went around, and you had the big bell curve of the how an epidemic unfolds. And the goal was to flatten that to below where healthcare could deal with it and it would be over. There wasn't a framing of multiple waves. There wasn't a framing of, oh, guess what? All the restaurants are shut down and so on. So I do think that, and this is where this gets to a point, and it's an uncomfortable one for me, because not only, am I leading a project with science advice in the title, and you're in an organization with science advice, but I do wonder if we are doing a disservice at this point in emphasizing science advice and you said it exactly right. What we're talking about is expert advice. There's expertise, and some of that expertise, I mean, I define science, in my classes and so on, very broadly. But when you frame an issue as a scientific issue, certainly members of the public and policymakers might think doctors with stethoscopes, astronomers with telescopes, Martian landers. They're not going to be thinking about sociological alternatives for framing an issue and the consequences that has for policy outcomes. There's a debate going on right now in the expert community. It's in the United States, and I think elsewhere, to what degree should we emphasize and focus on vaccine hesitancy? Do we not elevate that and make that as something that seems important or relevant or more meaningful than perhaps it is? So I do think that the choice of framing issues, and by framing how we construct how a problem is viewed, it obviously sets us on a path where some options are considered. We go down some routes, we close off others. And, for the most part, you don't have a lot of control over that. It happens organically in the to and fro of politics. But certainly experts have a very important role to play there. And I just think back to the flatten the curve argument, which was, again, a public health framing. But what if the framing was something more like, protect people while keeping the economy open, or so? I don't know what it would have been, but it would have been something that would have recognized that there are multiple valued ends here, not just one. And it's a great point, and understanding that, I think, starts with us realizing that expertise and expert advice is beyond just what the dictionary definition of science advice.
Totally agree. And your sort of shift from science to expertise also allows for multiple forms of expertise, as you say, including expertise, I think, that we're seeing increasingly comes from communities, community organizations, and obviously, local and indigenous knowledges and different forms of knowledge, which I think is increasingly being
Absolutely.
Understood as part of all of these discussions. But I think what this opens up too is an opportunity to discuss something that you're very well known for, and that is kind of a typology, right, of understanding where experts fit. And I'd like to sort of turn to that now and think about whether or not our view of experts and expertise is changing, and if it is, where do experts derive their legitimacy, and is that changing? Because, where once we relied on sort of scientific methodologies to offer legitimacy to the knowledge that was produced, we relied on scientific experts to sort of proffer their knowledge and then remain quiet. We're starting to see, or are we getting to a point where we need those experts to be a bit more vocal and a bit more nudging and a bit more provocative in how they're offering options and integrating knowledge? And if we are, what are the consequences of that for how they have previously built their trust and legitimacy with the public and with the politicians they serve?
Yeah, well, in this seminar series over the next 3 years, we'll sort this out. But now, it's a great question. It's a fantastic question, because I think at the core, for me, this boils down to issues of not just the legitimacy of expertise and the legitimacy of science, but democratic legitimacy, much, much bigger, and the role of experts in democracy. And yes, it's true. Not every country in the world is governed democratically and experts play a role in non-democratic systems. But if you look at the subset of countries that aspire to some sort of democratic governance, we do have this challenge in that running a modern society, governing a modern society that has nuclear power plants, that's dealing with climate change, that has public health emergencies, can't be done without experts. But at the same time, that governance grounds its authority and control in legitimacy that's granted by the public. So in the United States, for example, we elect our chief executive, and in my view, we elected someone who was fairly incompetent, Donald Trump. And that's a democratic outcome. He was the legitimately elected official. So what happens in a situation where outcomes are in conflict between those that the expert might call for and those which an authoritarian but democratically elected president in Brazil or Hungary or the United States happens to be in power? For me, the most important thing that can be done, there's no answer to that. There are better and worse answers, but for me, it's to have this discussion that we who fancy ourselves in the expert community need to, the phrase I use is we need to make peace with democracy. And we need to realize that the roles that we play can make things better or worse. And so a few considerations. So governments around the world have put in place formal expert advisory committees of government employees or non-government employees to advise them on science, on options, and so on. In some places, and so I'll pick on the United Kingdom again, some members of the formally established body, in this case, the SAGE group, have decided that that is not sufficient. They need to go out into the media, to go on Twitter, to lobby or advocate for the policies they think are more important. At the same time, we see groups form outside of those formal advisory bodies. And again, in the UK, there's a group called the Independent SAGE that's led by a former chief scientific advisor. So perfect recipe for confusion among all sorts of observers. But the question that I think we have to ask is in taking on these different roles, sometimes a different role in the morning as we play in the afternoon, are we helping or hurting the challenge of democratic governance? And it's not clear to me that we have had that conversation in such a way. So my view very much is that if you are a formal government advisor and you're working hard with other experts to provide some sort of synthesis of advice that requires trade-offs and uncertainties and so on, and then the very next day you go out and undercut that advice in some manner, you may be hurting the process. I am all in support of, you and I are engaged in organizations that all we do is we give advice on advice and nobody asks us for it, and we offer it out there. And so it's perfectly legitimate and can be very effective for people outside government to offer advice. But I do have questions such as the UK, when the outside group, which is independent, takes on the formal name of the inside group, which can only foster confusion. Certainly among the public, probably among the media, and maybe even of policymakers, whether that undercutting of official authority is or is not appropriate. Another example, the United States. So the Trump administration, when the pandemic started, it put in place what was called the Coronavirus Task Force. One thing to know about the United States response is that there was no plan in place for how expert advice was to be organized or marshaled in support. This Coronavirus Task Force was comprised entirely, with only one exception, of what in the United States are called political appointees. These are people who are selected to serve the Trump administration and advance President Trump's political interests. The exception was the celebrity we talked about, Anthony Fauci. Having a group of political appointees is not a recipe for securing good expert advice. But there were very few experts in the United States who were involved in that process. So Anthony Fauci or Deborah Birx are two names that were willing to actually say that out front. So you have, in the United States, you had this cacophony of voices. You had people at the state level, people at the county level, people at the university level, people at the sports league level, offering all sorts of contradictory advice. Everyone had an MD or a PhD after their name. And for me, it lent itself to what my colleague Dan Sarowitz calls an excess of objectivity. So you tell me what science you want, I'll find you the expert advisory group that has it. And I think it really devalued the significance of expert advice. So how do we deal with that? I mean, it's the sort of thing where we have to organize ourselves to provide expert advice in a way that's legitimate if the governments aren't doing it properly. And so what you say is, do we have a new set of responsibilities? I think the answer is yes, we do. There was a time, maybe it was as recently as 2019, at least I thought that the job of expert advisors was to figure out how to provide advice to decision makers who wanted to receive advice. And if they received that advice, they would have the competency to pick this or that option. I may or may not agree with it, but they had the competency to implement it. And at this point, I'm thinking, looking around the world at the variable responses, what do we do as expert advisors if, number one, the principal who we're advising doesn't want our advice, they're undercutting what we're doing, or two, even if they want our advice, they don't have the competency to implement it. So it dramatically expands both the responsibilities we have, but also the scope of factors that we have to integrate when we're thinking about providing advice. It's not just what are the uncertainties associated with the delivery of the AstraZeneca vaccine. I mean, it'd be great if it was that simple, but it's what do we do when there's deep political polarization, a principal who is trying to undercut science advice, and a government that's incapable of delivering it. I mean, that's the sort of thing that I don't think I've had very many discussions of with my students in classes, but I think we will going forward. And again, I do think, for people around the world listening to this, I do think the Trump administration was anomalous, but I don't think it was unique. I think we have enough experience around the world where democracies kind of go off kilter a bit. And I'm not sure the United States has passed its Trump moment. Who knows what happens in a few years. So expert advisors do have a window of opportunity in the United States, at least, to get things kind of sorted before things change. But even under the Biden administration, with all the goodwill towards science, there's a tremendous need for thinking institutionally about how to organize advice.
Roger, you've brought up again so many things there, and there's just one that I will come to because I need to, I guess before we leave, I want to come back to your very famous work, The Honest Broker. And what you've said here is, are there a new set of responsibilities for expert advisors? And if that's the case, it's not a question of just waiting for the demand, as you've indicated. Is it, I guess I'm asking, a question of being more proactive? What does that mean for honest brokers? We talked about legitimacy, we talked about trust, but at the end of the day, does this mean a much more proactive role for researchers, for academics, and is that possible?
Yeah, I mean, so the answer is yes. And I want to be very precise here because when we're in this era where science communication is a thing, it's a field, and the idea of being proactive as experts and scientists is often interpreted as you need to go out and loudly advocate for the policy or the outcome that you think is the best and will best serve people. There's no shortage of that going on. I think that in the absence of governments developing policy options, honest brokering, the expert community needs to be much more proactive in expanding options, if that makes sense.
Yeah, it does.
It's remarkable to me that we wait for the demand more often than providing a supply to meet a demand that should be there. So here's an example. In the United States, one of the first things that the Office of Science and Technology Policy, which is where the President's Science Advisor sits, did was to ask the US National Academy of Sciences, so one of the world's leading science academies, which is a quasi-governmental body. It's funded mainly by government, but it's not governmental, to put together an expert advisory body on the coronavirus. They did this very early in February last year. That committee met a few times. There was no demand from the Trump administration. They didn't want experts, didn't need experts. Rather than go off and say, well, we're going to give you the information that we think you should be asking for, they basically did a few things behind the scenes and a few reports that weren't timely. I think it was a real missed opportunity. And again, it's high level, it's political, but we need some of our top leaders in the scientific community to engage, not on sign-on statements, not letters, not we support the Paris Agreement or we support lockdown. It's, open the schools. It's not pick your favorite policy, because then you just get wrapped up into the politics of whatever setting you happen to be in. But to say, look, if the goal is to integrate economic and public health outcomes, we're going to give you a set of 4, 5, 10 options that you could implement with the following expected outcomes. And for us, it disempowers the experts because we don't get to put our finger on the scale and say, we want this outcome. But what it does do is it makes clear to the public, and it gets back to the question that you raised earlier, it helps to frame debates. And if people are debating, how do we integrate public health and economic outcomes, for me, that's an improvement, whatever decision is made, than the lockdown, no lockdown debate. So I do think that by being more proactive, by taking more of a public leadership role, the expert community can both improve the quality of debate, but also improve the framing of how problems are brought to the public and policymakers.
That sounds like a recipe for success. You've actually articulated precisely something that has been really troubling me, which is exactly that. So how do you be proactive when you know that kind of proaction is required, and yet not be unduly influential or be seen to be an advocate? And what you've suggested there is that it can be done because what it's about is being proactive in expanding the options, in sort of elevating and expanding the debate, which I think is really great advice, and probably the perfect place to leave this discussion. Although I have to say that I regret having to draw it to a close, because it's been so wonderful to talk to you and sort of canvass your thoughts about everything that's been happening and everything that we're learning from it and everything that we're observing. And I dare say we'll probably be coming back to you for more.
Christiane, thanks for having me. It's been great. I look forward to continuing to work with you on our ESCAPE project and working with INGSA, which is one of my favorite groups in the entire world on this topic.
Thanks so much, Roger.
Thanks, Christiane.
Bye now.